Congratulations on finishing your colonoscopy. I hope that it was easier than you expected. Let's discuss everyone's most pressing question: what did we find? A patient's first question is going to be, what did we find? And of course, sitting here, I can't know that exactly. So let's discuss a general framework for understanding common results. Because we just did a colon cancer screening, the big worry is that we found colon cancer. And I want to reassure you that that's really uncommon. What we're going to discuss is the much more common findings. And happily, one of the most common findings is absolutely nothing. And that's because as many people that do make polyps, there's many who make none. Now, there are two very common findings during a colonoscopy, and neither is worrisome. The first is diverticulosis. And I want to reassure you that this is almost certainly not diverticulitis, which is the condition of those little pockets being infected. And the reason I can give you that assurance is because if we come across angry, pussy diverticulosis that looks like diverticulitis, then we're probably going to stop the procedure and say it would be safer to do this at a different time. So if you got through it with relative ease, then you probably just had diverticulosis and need not worry. A second common finding is hemorrhoids, and this is a common cause of benign rectal bleeding, maybe the reason that you were having your colonoscopy. We want to make sure that there's nothing more concerning causing your rectal bleeding, and so if all we find is hemorrhoids, then that is great news. Now, polyps are going to be the third common diagnosis that will be reported after a colonoscopy, and this does draw a little bit more worry because people have often heard that they are a precancerous lesion. But what I wanted to tell you is that the point of a colonoscopy is not just to find those little buggers, but to remove them. And the vast majority of the time, we have accomplished that by the time you've woken up. And so people often ask, did you remove the polyp? And the answer is almost certainly, yes, we already have. Now still, polyps kind of provoke a little bit of anxiety for some people. They usually are predating any cancer by probably 10 years. And while we understand that essentially all cancers arise from polyps, the opposite's not true. Most polyps will never amount to anything. All the same, we're going to look for those that are of any kind of concern and just go ahead and pluck them out so they can never be a problem. Patients will often ask if we biopsied a polyp. We don't want to biopsy a polyp. That would merely be resecting a small piece of it. We want to take out the whole thing. From there, practice varies whether we send it to a pathologist. We may not if it has a small typical appearance. But if it's larger, then it's probably going to be sent to a pathologist. A number of factors come together to determine when you should have a follow-up colonoscopy. There's your personal history, family history, the number of polyps, their size, and ultimately the pathology is really only one small piece and may not always have that much weight. Again, I want to emphasize that when there's a small polyp, the chances that this is cancer are pretty much nil, and so there's no reason to be worried about a pathology report. In fact, oftentimes the pathology report might prove that the polyp was a type that we need to have no concern of, and depending on its location, it might actually land you back at everybody's favorite result, the 10-year follow-up. The natural follow-up question is that if a polyp has been sent to the pathologist, when will we get results back? That varies depending on the GI practice that you had your scope at. But again, I want to provide that reassurance. There's no urgency to these path results because we're really trying to determine a question of, do you need to follow up in 5 years or 10 years? And so we're not going to ask the pathologist to rush those specific results. When we might is when we find something that does look like a cancer. And in those cases, we are going to take biopsies because we cannot resect an entire tumor in an endoscopy. So if we found a tumor, we're going to let you know that straight away. We're going to give you a chance to wake up, have family come, and find extra time to discuss what this means for you. And what it's going to mean is that you're going to follow up with a cancer team. You're going to need to have some imaging done in some other labs. And again, the pathology is very important, but it's only one piece of the puzzle. And I want to again emphasize, it is a very clear, stark difference between a polyp that was easy to just pluck out and a cancer tumor. And there's not going to be really any discrepancy in the way that we talk about it. We're either going to say, I'm really concerned, it looks like you have a cancer, or great news, we found some polyps, removed them, and we're going to see you somewhere around 5 years from now. I hope you found this video to be helpful to understand the results of your colonoscopy and give some context to the findings. If you had common findings, then take comfort knowing that these are not worrisome. And if something was found like a cancer, then be reassured that your team is going to get you forward to the next steps that you need to take care of this problem. In a video coming up soon, we're going to discuss other questions commonly asked after a colonoscopy, so please subscribe to be on the lookout for that. Thank you and be safe.